Hi, this is Andrea with Lesson Health, and I'm here today with Dr. Pakhi. She's a board-certified pediatrician, medical acupuncturist with over more than 25 years of experience caring for children and families. And after 2 decades in primary care, her passion for helping children with autism led her to launch a precision medicine practice and explore additional therapeutic tools. Building on her acupuncture background, she became certified in Qigong Sensory Training, a parent-delivered therapy supported by more than 15 years of research. Welcome to our summit.
Thank you
We're
so much,
happy
Andrea.
to have you.
Yeah, thank you.
So can you tell us a little bit about yourself?
Sure. Yeah, what I'd really love to share is that 20 years ago, I just graduated from my residency, and Physicians for Social Responsibility had put together a talk for physicians that talked about, it was called In Harm's Way, and it was about toxins in our environment, and that we had 80,000 new chemicals in our world, and that there had been no testing on children, and that the preliminary testing was starting to show some really big concerns. And they literally said that here's the IQ curve, and if things are going to unravel in the way that we think they are, that curve is going to shift, and suddenly you're going to have a significant number of kids that have a decrease of 5 points in their IQ. And that really makes a very big shift in the overall population, right? And so I heard that, and then I went off to do primary care, but it was always in my mind, and I always kept that information very at the forefront. So I did recommend organic food from the very beginning, et cetera, et cetera. Then I just watched the tsunami of neurodevelopmental issues occur in my practice. And after 20 years and noticing that I used to take one kid where they became chronic care and had a lot of issues, it became every kid that had tons of issues, whether it would be autism, ADHD, or mood disorders. I suddenly had a child psychiatrist in my tiny little practice in Durango that used to come once every other month, and I talked to the man every day, even though I was doing a lot of alternative therapies. So I was once feeling like my best work was in the room with the patient, but suddenly I was like, this bridge is broken. We need to work on toxins in the environment. We need to educate everybody around this. And I left primary care to actually work on environmental health. And then one thing led to the next, and suddenly I was doing precision medicine because there were some really amazing things that happened there. And then as I was doing precision medicine, I bumped into a little bit of a wall with some of my kids, and a friend of mine who was an acupuncturist was, remember that Qigong sensory therapy? And I was just like, yes, let's, I actually looked to find anyone in my community that was actually doing it, and they were all OTs that were in schools, so I couldn't refer to them. And so I was like, all right, I'll just take the course, and I have been blown away. My first 2 kids made profound shifts. Like literally within 10 days, a kid stopped headbanging, and it was gone after having done headbanging for 2 years and that kind of thing. So anyway, so that is sort of my entire journey to Qigong sensory therapy.
Wow, that's a lot. And just to let the attendees understand, can you start off with just explaining what Qigong is, and then how the therapy is different than just a Qigong practice?
Absolutely. So Qigong is, Qi is the life force, and Gong is the act of sort of cultivating, or the skill of working with. So Qigong is the skill of cultivating and working with the life force. And so Qigong is a branch of traditional Chinese medicine that is 3,000 years old. And if you do a quick PubMed search, you will find over 2,000 articles that show that Qigong is used in different ways. There are many different kinds of Qigong. There's Qigong like a self-practice. There's Qigong where a Qigong master sort of moves your energy for you. There's a Qigong practice where there's a combination. And so what happens with this Qigong sensory therapy for children is that the parents provide this therapy for their child. And I'm going to back up just for a quick second and say that in the 1980s, an MD acupuncturist looked at autism through the lens of traditional Chinese medicine and found that it fell into this category called the partial closure of the orifices, where the orifices are the sense doors. And it was in 2013 in the United States that sensory issues were added to the diagnostic criteria for autism. And so it kind of even 3,000 years ago, even though they may or may not have had autism then, they actually had a way to look at autism that then made it such that she could create a protocol to address that issue of opening the sense door. So that is technically what's trying to happen with the 12 movements that a parent does. So the parent does this every single day. It takes about 15 minutes. But at the beginning, a therapist sort of supports them in giving this, because everyone knows that a child with autism is not particularly excited about being touched, right? And we now know they have areas that hurt when you touch them with light touch, and areas that are plain, like, just numb. And so one of the things that happens, like when you go to hug a child, like, if there's a child in distress and you go to hug this child as an adult, you're hoping that hug is comforting. But a child with autism that we are now starting to understand has this thing called multifocal tactile impairment and even multifocal sensory impairment. If you go to hug them, there's going to be areas of their skin that hurt and areas that are numb. So this child in distress with a hug is not going to be comforted. And then you might actually go to like shush them. You might shh like a baby, right? And then if that's like a loud sound, or even the wind from the shushing is irritating to a child with this sort of sensory impairment, that's going to cause trouble. And then you're going to move them out and try to make eye contact to try to help soothe them. And we know that kids on the spectrum and adults have stated that it's very overwhelming to use direct eye contact. So we are learning that they have all the senses are getting sort of faulty information. And that leads to self-regulation issues and dysregulation. And the attempting to stim and do these different behaviors that are trying to get the body regulated. Does that make sense?
Yeah. So this therapy is actually massage, because when I think of Qigong, I think of more of like a movement practice.
Right. So I think we're trying to get away from the word massage simply because it means something immediate to like the rest of the world. But in the end, it is parents touching their child and helping the child receive touch on areas of their body that they don't normally receive touch. So the thing that's very unique about this is that, first of all, the energy is being moved in a very specific direction. And because I'm an acupuncturist and I do a needleless form of acupuncture on children, the beginning, I would say, is almost like a computer reboot. Like, we know, for instance, in Western medicine that you want blood to go, from the heart to the rest of the body and then back into the, and you want everything to flow in a very specific direction. So energy, according to the whole traditional Chinese medicine world, in these meridians also is supposed to flow in a very specific direction. So the parents are doing a particular kind of hands-on therapy that helps the energy move in a direction. But what's most important is that they attune to the child. So as the child, there's a movement that you do on the fingers. And as you do this, if the child moves their hand away or is ticklish or seems like it's uncomfortable in any way, you actually change to holding the finger. And that change goes from clearing the energy to clearing blocks to filling an area of deficiency. And it allows the body to receive touch in a place where they couldn't receive touch before. So we're actually probably bringing circulation to areas of the skin that never previously were getting that kind of circulation. Does that make sense?
Yeah, that's really wild. And by increasing the circulation, is that supporting detoxing?
Well, yes. I mean, so some of the movements themselves actually support detoxification. So increasing circulation, we're not only increasing circulation on the surface level of the skin. I think that there is quite a bit of that happening. But because we're working with these channels, we're also kind of getting the whole system to circulate even better. So we are helping digestion. And, so many kids will, after a couple weeks, actually pass a green slimy stool. Like they're really like doing kind of a detox after a couple weeks of getting this, Qigong sensory therapy. I do find that kids are detoxing with this, as well as regulating, and sleep oftentimes becomes dramatically improved. Being able to eat more of a variety of foods oftentimes comes on board as well, just because their digestion is improved as well.
It's so impressive, because I know those are the top two things that people I usually try and focus on improving the digestion and detoxing the body. And can you speak a little bit on what the research is showing?
Yeah, so Dr. Luisa Silva was another MD acupuncturist, and I really feel strongly that this isn't kind of well known yet because she died in 2018 from cancer after doing 15 years of research. So she did 15 years of research. She published 21 studies that were kind of Qigong sensory therapy specific or related, because she did create a variety of intake forms and sense and self-regulation checklists for autism. So there's 15 years of therapy, 15 years of research, 21 published studies, and 4 randomized control trials. And the first 3 trials were with children 2 to 6 years of age. And they showed that after 5 months, there was approximately 30% improvement in autistic behavior and a 40% improvement in parenting stress, which is a big deal. And after 2 years of this therapy, 1 out of 4 children actually no longer met the diagnostic criteria for autism on the childhood autism rating scale. And that compares to current AAP and Cochrane review things that show that basically 1 out of 10 kids by reaching adulthood may no longer carry the diagnosis of autism. So the research is really pretty profound. She was so excited about what she found for the 2 to 6 year olds that she did another study where she worked with 6 to 12 year olds. But because the study requires that they're not in any other therapy, she was not able to get huge numbers. So she wasn't able to prove that their behavior improved because they just didn't have the power. But I mean, that's what they showed, but you can't kind of call that because of statistics. But she was able to demonstrate again that there was an improvement in the tactile responsiveness and normalization of the tactile issues. And so now, you know, through the lens of the Qigong world and traditional Chinese medicine, she was able to demonstrate also that the severity of the tactile issue correlated directly with the severity of autism. So that over time, if you improved the tactile sensory issues, you were absolutely also improving behaviors and, you know, all the other things. I mean, speech was along that line, and social, emotional interactions, et cetera, et cetera.
And are you finding similar numbers in your practice?
I am pretty darn blown away by how quickly the majority of kids are responding. I will say that she did this work before our latest issues with mold. I think you'll find out from one of your speakers that mold is a really big player now, and I am now noticing that I can tell which the kids, most of them are just moving. And if they are moving slower than I anticipate now, I go looking for mold sooner than later, frankly. But it is just amazing. You know, we have head banging that goes away. Suddenly we're sleeping. Suddenly we're jumping with both legs where we never did that before. Looking in the mirror, checking ourselves out, understanding multi-step commands or requests, you know, that were happening. Really understanding what's going on in the world around them and being able to express their understanding of that. It kind of goes on and on. The list goes on and on. You know, suddenly we're able to tolerate water on our face where that was not going to be possible. Swimming lessons weren't going to be possible until we could tolerate water on our face. And so these changes are happening actually quite rapidly. Hugs from grandma that we never ever allowed before. You know, those kinds of things that are just really precious, right? It's been, you know, pretty life altering within weeks of starting the therapy, I would say.
And have you seen any research or had any personal experience with this kind of therapy for adults?
No, and I think what has happened is basically, again, Dr. Silva passed away. I mean, I think she had many different ideas of what to do for therapy, for future research projects, and I think she would have done, you know, the 12 to 18 year old and then so on. I will say anecdotally, people who have done this for 20 years, there are folks who have said like they've anecdotally worked with 20-year-olds, for instance, and seen really nice changes as well. And I might have the opportunity to work with an adult that's over 30 soon. And I'm so curious to see how they do, because we know about neuroplasticity and we understand that the brain is always changing. I think it's going to require like more hands, to be honest, because it requires more energy input into this body to like, shift something that's been going on for decades. But I will keep you posted on if I have that opportunity to work with this adult and how they do.
Yeah, that would be awesome. I feel like most of the summit, like we're saying children, 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 but
Yeah.
I do want people to know that,
Yeah.
just because somebody is an adult doesn't mean that they can't still benefit from interventions. And
Absolutely. Absolutely. And I will say again, anecdotally, there have been people that had good responses with people in their 20s, young adults. So again, this person who is well over 30, that will be interesting to find out what kind of response that we get.
definitely. And can you speak to the process, like how to find a practitioner, and then once you find one, what that looks like usually as far as the training and the
Yeah, absolutely. So let me
therapy?
share this website. So this is the sort of official Qigong Sensory Therapy website. And you can go to find a QST certified trainer. And then they're listed literally. And so you'll see they're actually all over the world: Asia, Australia, Canada. I know someone right now that's being trained in Bhutan. So it is international. And you can find a person and then reach out to them. And if for some reason you cannot find someone in your area, they have just recently launched a pilot app. And this is the website for that, where you just go in and write in eligibility and kind of give your information, and then they will try to connect you with somebody. So the vast majority of people providing this service are OTs, and so some are taking insurance and some are not taking insurance. It is approximately 20 sessions where they meet twice a week for 5 weeks, and then there's a 5-week break from the therapist where the parents continue to do the therapy at home, and then another 5 weeks twice a week. And then the parents are sort of off on their own, and we sort of check in monthly to see how they're doing and to ensure that they're continuing with the massage. I would say the vast majority of families just love it because it's this very sweet bonding. That is one of the most beautiful things that happen. I mean, I had a kid that within weeks, mom was playing hide and seek with the younger sibling, and the 7-year-old found her when she was hiding and joined in the play. And then since that time, he started to tap his brother on the head and initiate tag. Like, this was the first time this child had ever played with his younger sibling. So it was just profound, right? I mean, it's really life-altering stuff. Yeah, so where was I? So this is where you like hit the eligibility thing and then you find out. And so sometimes your insurance will be able to cover it. I don't take insurance. As an MD, I'm doing precision medicine, this, that, the other thing. So I'm just doing cash only. But I can only see patients in, Massachusetts and Colorado. So there's an entire world of people who need therapists. And so between these two websites, hopefully people can connect.
This is something that anybody could learn to do for their child?
Absolutely. Yes. There's a whole handbook that one can purchase. And there's a second book that was recently brought out to like even speak to even more sensory issues than simply autism. And everyone can learn it, but I do recommend, and the studies show that if a child, when she was doing the studies, they had mild, moderate, and severe, and I just don't think that we really have, level 1 is not mild. It's really it's a level up from what used to be mild, frankly, and they show that the kids that were mild, the parents being taught how to do the massage and then sort of sent off on their own did just fine, and actually maybe even did better. But any kiddo that was moderate to severe, they really benefited from having the QST trainer, because as you might imagine, these kids don't receive touch very easily. So parents can get a little disheartened or not know what to do if they're trying to do the massage and the kid's jumping up and running around. And, it takes the person that's had a lot of experience to say, this is all fine, this is all normal. And we just have to change how we're touching this child. Like if the patting, made this kid jump up, then let's change to what needs to happen and see what happens with that. And sometimes you change this and it's not better, and then you have to go even faster. So it's a very dynamic process. And so having a trainer, support a family when it gets challenging is really, really helpful. And to help see the child, not through the lens of behavior, but through the lens of energy is really fascinating. When Dr. Silva created a checklist for these kids, she said, that kiddo that has a hard time getting out the door is not just a behavioral child. She's like, what if it hurts to wash their face and it's really uncomfortable to brush your teeth? Like, it actually is physically uncomfortable. And then, we're not potty trained because we can't feel if we're dirty or clean or dry or, all those things that have been sort of lumped into behavioral challenges. If you look through the lens of the senses, it suddenly is a very different thing. And so now we're trying to look at these kids through that lens when you're doing the therapy, so that you can really alter your touch so that they do relax. And so that, you do want them by the end of the session to be laying on the table as though they had a beautiful and wonderful massage, because that means that their parasympathetic nervous system has been turned on. And how often does that happen in these kids, right? And just any moments where they live in that parasympathetic tone is critical and wonderful and healing.
Are there other applications besides autism that are being researched or used?
So there were some research projects with Down's kids, and they actually gained speech more rapidly than the kids on the spectrum, interestingly. There was also a study with kids with cerebral palsy. And so there are other, and then I think we talked a little bit about even the very first article that Dr. Signalini, who is the founder of Qigong Sensory Therapy, she wrote a paper that said autism and ADHD all in one breath. And so I think that there just haven't been funds to do the research on these different populations. But the beauty of this second book that was published after Dr. Silva died, she co-authored it with Linda Garofalo, who is an infant health mental health specialist. She's also a massage therapist. She's also a Qigong sensory therapist. And she is at, oh goodness, I'm going to forget, she's at Montclair University. And they co-authored this book to talk about sensory issues as a bigger bucket. And there are so many other kids that are not on the autistic spectrum that have sensory issues that really benefit. It's a different approach to how the 12 movements are done, but it's essentially the same movements done differently for different issues. So yeah, it's exciting. I think the hope is really to make this very standard of care for what OTs have to offer, so they can offer this to all the variety of kids that they offer sensory therapies to. And on that note, there was a 2018 systematic review of 11,000 articles that were looking at sensory therapies, and the Qigong sensory therapy sort of bubbled to the top as like one that really demonstrated efficacy in working with kids with autism. So Dr. Signalini looked at autism through the lens of traditional Chinese medicine and asked the question, what is autism from the medical Chinese, traditional Chinese medicine perspective? And she came up with the fact that it fell into this vast class of closure of the orifices. And the orifices are all of the sense doors. So here we have all the senses. And everything that falls into that category is any disorder that implies a defect or blockage of the physical, emotional, or cognitive interaction with people and the environment are included in this vast class. And so I would say that pretty much any child or adult, mild, moderate, severe, level 1 through 3, really does fall into that category where there's a defect or blockage of the physical, emotional, cognitive interaction with people in the environment. And so, complete closure of the orifice is actually a coma, so that is not what this is. but it is a partial closure of the orifice, a partial closure of the sense doors, that the sense doors or the senses are not working correctly.
There's some people that think of ADHD like on the same spectrum of autism, just maybe a different like it manifesting it differently.
Yeah.
I don't know if there's any validity to that, or if they're intertwined, because I know it can coexist together, right?
Absolutely. So someone with ADHD does fall into that class because they're having difficulty with people or the environment and how to sort it all out, right? And so it's a huge class. And so what Dr. Silva said was like, okay, what is partial closure of the orifices in autism? And that is different than the other things that might fall into that class. Does that make sense? So from the Chinese medicine perspective, they are sort of in the same bucket. I would say that I'm more comfortable saying that than speaking to the neurophysiology of ADHD and autism of what we know right now. And I think it's all going to turn on its head pretty soon as well, because there's some really exciting information coming out of this perspective. So what was really interesting is that Dr. Silva said, everybody that's looking at the sensory issues is really looking still at the central nervous system. We've scanned these kids' brains. We've, done all kinds of fMRIs, PET scans, et cetera. And we're finding some trends, but we're not really finding like the thing. And she's like, we need to look at the peripheral nervous system, because what we're seeing is that if this spot is hurting and with light touch and this spot is numb, then this isn't going on in the brain. This is going on right here. And so she decided to take skin biopsies of 4 children and found that they in fact had 50% less of the sensory fiber. And she was over the moon with this information and begged the bigger community. She published it in a neurology a journal, and she requested that someone repeat it. And then she passed away prior to seeing that in 2020, they had a study where they took 32 autistic men who are 25 years old, and they showed again that they had decreased sensory fibers and that the sensory fibers functioned very differently. And, one might say abnormally, just they were functioning differently. So it was a really interesting, there's some converging, emerging information that at least a substantial number of people with autism have something going on in the peripheral nervous system.
Yeah. Okay. That's so much great information. I'm really learning a lot. So how can people find you if they want to learn more about what you're doing?
So they can find me on my website, and that is just PakhiChaudhuryMD.com. I completed this certification course in October, and I have not updated my website at all because I'm about to change my entire life. So I was doing precision medicine. I'm folding in the QST, but now I'm really about to go all QST, and so it depends on what I'm really like in flux right now as far as what is my next step and how, will I be getting involved in research, or will I be facilitating more people doing this, statewide, worldwide, et cetera. So we're going to see what happens next. But if they want to reach me, they can shoot me an email through my website for sure.
Awesome. And can you just touch real quick on what precision medicine is?
Absolutely. So precision medicine is it's based on your genomics. And I was using Intellect's DNA was the tool that I was using for determining what are some of the ways in which genes are interacting with the environment and potentially playing a role in someone developing autism. For instance, in the genetic world, we know that kids that are on the autistic spectrum now, through precision medicine, we know that pretty much all of them are having trouble with detoxification. And we now live in a world with over 200 chemicals in the cord blood of a baby, right? And people are walking around with over 400 chemicals. So if you cannot detox in this world, you are going to run into some trouble. The second thing is that we know that these kids seem to have trouble with their gut. They seem to have more susceptibilities with their gut. And so there's genomic evidence of more genes that have to do with celiac, for instance, or their gut lining is more easily permeable if it gets inflamed. The third thing is that they seem to have runaway inflammatory systems, so that once inflammation starts, horses out of the barn, they cannot seem to pull it back. And we have so many things that are causing inflammation in our world today. And then fourth, they seem to need higher doses of specific micronutrients. For instance, a kiddo with the SHANK3 gene needs significantly higher doses of zinc. And you may check these kids' blood levels and it may not show that it's particularly low, or it might be a little bit low, but it's not going to alarm you that they need higher doses of zinc. And our food and our soil is so depleted. We have 50% of the magnesium in our soil and 50% of the iron that used to be there, so that our food has less micronutrients, and therefore our brains are kind of starving. And then if you need these higher doses of certain micronutrients and you're not getting it, so then you get these all these variety of hits. So it's sort of lovely to be able to sort of pinpoint the areas of weakness that a child might particularly have, so you can shore those up as soon as possible. And it's really fun and wonderful.
It really speaks a lot about your passion, that even with all that, you're shifting to the Qigong therapy.
Yeah, the reasons why are the Qigong sensory therapy is a standalone therapy. You need no other testing. You basically need parents that are willing. You don't have side effects. It's very low cost, and the benefits are sort of over the top. And so I feel like it's really accessible to everybody. I love precision medicine, but not everyone's going to be able to afford to do it. But the Qigong sensory therapy, I hope to make it such that people, when they go see their OT, that's the therapy that they get. And how many kids might we divert as in those early years so that they don't actually need precision medicine or any other biomedical interventions, right? So that is my hope and intention.
It's so interesting to me to see this combination of all these environmental, the nervous system, the behavior, the gut. This is the end of a week long of all these experts speaking on all these topics, and it's really amazing how you don't have to address everything all at once to start getting results. If you just pick your lane and go with it, and then let things unfold, these miraculous results happen with all these different kinds of therapies and treatments and things like that. And then, like you said, improve the circulation, and then the detox system works better, and then the gut gets better, and then you can absorb more nutrition, and all these things. It's just one little trigger after another. And I mean, for a very long time, people were just told, your child's autistic, go to speech therapy, find ABA, maybe OT, and that was the bulk of how people were given, and it was thought of as being this stationary thing where it's just an identity, it's their brain system. And you're saying that some of these children, after the therapy, they're coming back and they're not even testing as having autism anymore.
Right. Yeah, I'm actually quite sad and horrified that the majority of families that come my way have been told by somebody, whether it be their pediatrician or their neurodevelopmental physician, that they should not be trying to cure their child of autism, and or do anything, that there's nothing else to do. And I am really sad that that is what people are hearing on a regular basis. And again, that's sort of why I'm kind of rededicating myself to Qigong sensory therapy, because it has the possibility of reaching everybody. And you know, the OTs have been working with the sensory system for a very long time now, and their framework is also that the sensory is sort of the base, and then you build on top of that. So I think that it's not a really big sell to that particular world, and these, you know, the vast majority of these kids are seeing them. So there's a lot here to try to get out into the world, actually. So we'll see how I do. How we do. It's a whole cohort of people who've been doing, I mean, there are people that have been doing this for 20 years prior to my work with this. And, you know, they've been working on this, you know, around the world. But you know, it might be the time now to have it really catch on.
Yeah, I love it. And I'm glad to help support the movement for sure. Is there anything else that you wanted to speak to that we didn't talk about today?
I don't think so. I think the only thing that I really want to say is also that in these studies, that 100% of the parents, after doing this for a year, felt like the parent-child bond was improved, and that it continued. 75% said it continued through the second year, that it continued to improve. And I think there's nothing more exciting than that, really, in the end about it, because, you know, how hard have these parents been trying to connect with their children and been unable to do so in ways that feel fulfilling, that they know that their child hears them and sees them and, you know, appreciates them, or just even understands them, or even knows that they're there for them, right? And so I think that part is just incredibly beautiful. And that is the gift that, you know, hoping to give back to parents, is just that they're parents again, and they're bonding with their child. And that is, that to me feels like the biggest takeaway from what QST really offers. And I love that.
Perfect. Thank you so much. I really appreciate your time. I know you're a busy woman. I'll let you get back to your research, but we really appreciate you taking the time to share with our audience.
Awesome. Well, thank you. I really appreciate the opportunity as well.